Hello friends, today we will discuss about the blood vessels and circulation. So in the circulation, there are two major blood vessels which come into the existence. One is the artery which carry the oxygenated blood, and one is a vein which carries deoxygenated blood. The arteries deliver oxygenated blood into the tissues. They are thick walled, they are having extensive elastic tissue, and they are having the smooth muscle. They are under high pressure since they are directly in contact with the left ventricle pressure. The arterioles are the smallest branches of the arteries, and they are the highest site of highest resistance. They are having the alpha 1 adrenergic receptors as well as the beta 2 adrenergic receptors. The veins carry the deoxygenated blood. They are thin walled, they are having the low pressure, they contain highest proportion of blood, they have got largest total cross sectional surface area as it is written over here. They are thin walled and they are the exchange of nutrients, water and gases. They are all involved in the venous region. This is the structure of the normal artery. So you are having the adventitia here, the media and the intima, and the internal lumen is having the endothelial cell. So the endothelium dependent relaxing factor is released in this particular region. So the EDRF, the endothelium dependent relaxing factor, is nothing but the nitric oxide, which regulates the blood pressure. So there are 5 classes of blood vessels. So the first one is the artery. They carry the blood away from the heart. Arterioles, smallest branches of arteries. The capillaries, smallest branches of blood vessels. They are the location of exchange between blood and interstitial fluid. They are venules. They collect the blood from the capillaries, and the veins which return the blood to the heart. The largest blood vessels they are having in the pulmonary trunk. They carry the blood from right ventricle to the coronary circulation. The aorta, as you all know, is the largest blood vessel or the largest artery in the body, which carry the blood from the left ventricle and it is to the systemic circulation. The capillaries have very small diameter and they are the chemicals and gases which diffuse across these walls. So what are the differences? So although the arteries and veins run side by side, they are the thicker wall substances. The arteries are having the thicker wall. The collapsed artery has got small round lumen. Vein has large flat lumen. Vein lining has got the contracting lining, whereas the artery lining does not have the contracting lining. The artery lining folds, the arteries are more elastic, and veins have got the valves. So that is the key difference between the veins and the arteries. As I told, the capillaries are the smallest vessels with thin walls. They are the location of exchange functions of cardiovascular systems. The materials diffuse between the blood and the interstitial fluid. So this is how the capillary network you can observe as it is shown. So here are the arteries and here are the veins. So this is how the left ventricle pumps the blood through the aorta. You can see the aorta here, and you can see the right atrium is opening to pump the blood to the right ventricle, and you are having the tricuspid and the bicuspid valves here. So here is the tricuspid valve and here is the bicuspid valve. So this is the ratio or the distribution of blood in the system. So these are the different cross-sectional area which are there. So you can see here the capillaries are having very higher cross-sectional area. So what is the direction of the blood flow? So here the chart is given from how the lung to the left atrium, left ventricle, aorta, so all they go into. I had told in this slide, through the systemic circulation, the whole body is covered. So this part is nothing but the pulmonary circuit, and this whole part from the left ventricle here, it is the pulmonary circuit. So the heart valves, as I told, the heart valves prevent the backflow of the blood. The atrioventricular valves close when the ventricular pressure increases and the force of blood against the valve flaps. So the tricuspid valve and the bicuspid valve are the valves which are there. Just in the last few slides I discussed it. So it is given clearly here. It mainly works on the pressure. So when the ventricular pressure increases, the valves will close. When the atrial pressure increases, the valves will open, so that the ventricular pressure is less compared to the arterial pressure. So at that time the valves will open. Semilunar valves are located between the ventricles and the large arteries. So these open when the pressure is produced by contracting ventricle exceeds than the artery, and close when the arterial blood pressure exceeds the pressure produced by the relaxing ventricle. So there are pulmonary and the aortic semilunar valves which are there. So what are the functions? Obviously they prevent the backflow of blood from ventricles to the atria, the atrioventricular valves, and the semilunar valves will prevent the backflow of blood from aorta to the aorta and pulmonary arteries to the ventricles during the diastole. So these are the semilunar valves. So these are the bicuspid and tricuspid valves. So coming to the coronary circulation, as we all know, the coronary arteries are the one which supply the blood to the heart. So since it is given here, so the heart is having 0.5% of the body weight, but it receives 5% of the total body's blood supply, and most of this part is to the left ventricle. The reason being very simple, that left ventricle is the organ or the part of the heart which supplies or which enforces the blood throughout the body through the aorta. The coronary arteries are the left main coronary artery, the left anterior descending artery which serves as the interventricular septum, and anterior walls of both the ventricles are supplied blood with the left anterior descending artery. Circumflex artery is the one which serves the left atrium, and posterior wall serve the left ventricle. The posterior means they are coming into the posterior or the back region. The right main coronary artery is posterior descending artery which serves the posterior walls of both ventricles. The marginal artery covers the lateral wall of the right side of the heart, and the cardiac veins follow the arteries and join the coronary sinus which empties the blood into the right atrium. So the deoxygenated blood from the coronary circulation will enter ultimately into the right atrium. So this is how the coronary arteries are covered. So here you can see laterally from the posterior region, the anterior region. So the lateral region, the ventricles are supplied with the blood, the arteries, the atria, the whole region is supplied with the blood. So this is how the coronary arteries are located on the surface of the heart. So this is how the aorta is moving in continuation with your vertebral column, and from here it is divided into the different arterioles. So this is the effect of, or the influence you can say, of the sympathetic chains on the heart. Though the human heart is myogenic, the heartbeat is generated with the myogenic system, that is by the sinoatrial node, and it is set by the AV node. This is called the pacemaker, this is called the pace setter, you are having the Purkinje fibers. Though it is the myogenic organ, but the nervous system influences the heart rate. Though the nervous system cannot generate the heartbeat or the heart intensity, or you can say the cardiac cycle, but the central nervous system or the sympathetic nervous system which is there, it can influence the heartbeat or the heart rate. So that we will discuss in the coming lecture, how the SA node and AV node are involved in the formation of the ECG or the whole cardiac cycle, how they are formed or how the cardiac cycle is there. So in the coming lecture we will discuss about the SA node, the pacemaker, pace setter and the complete cardiac cycle. Thank you.